Good morning, everyone. A beautiful smile is a universal language of kindness. Do you know 70% of the population are unhappy with their smiles? The power of smile goes beyond appearance, closely tied to their self esteem and confidence. So, today's topic we will explore was to how to transform not only their smiles but also their lives. Myself, Dr. Swapna, Associate Professor, Narayana Dental College, Andhra Pradesh. Today, I'll be presenting on the topic dental bleaching as a part of Cynodent Dentistry Excellence Conclave. These are my contents. Coming to the introduction, aesthetics of the teeth is of great importance to the patient, including their color of the teeth. As dental awareness was increased day by day, the demand for natural smile and also white teeth has been increased. So, discoloration in any anterior aspect of the teeth is not accepting by the patients due to the dental awareness. So, the dental bleaching, often referred to as a teeth whitening procedure, which is the most requisite cosmetic procedure. It is a non-invasive procedure and also it conserves the tooth structure. Coming to the color of natural teeth, teeth are polychromatic. Tooth color is mainly determined by its optical properties, light reflection, color of the dentine, and by intrinsic and extrinsic colorations. We all know the teeth color is mainly darker at the cervical third and lighter at the incisal third. So, intrinsic color is mainly determined by the optical properties of enamel and dentine and their interaction with the light, whereas the extrinsic color of the teeth mainly depends upon the absorption capacity of your enamel surface. So, coming to the definition of your tooth discoloration, it is defined as any change in hue, value, chroma, or translucency of the tooth due to any cause. It can be divided as intrinsic discoloration and extrinsic discoloration into pre-eruptive and post-eruptive phenomenon, where in pre-eruptive you'll include diseases like hematological diseases, liver diseases, diseases of enamel and dentine like your amelogenesis imperfecta and dentinogenesis imperfecta, medications like tetracyclines and other antibiotics, fluorosis strains mainly because of the excessive intake of your fluoride, enamel hypoplasia like trauma or infection. And post-eruptive changes include trauma, mainly the pulpal necrosis that due to the formation of your hemorrhagic products, that is your pulpal necrotic products, primary and secondary caries, tooth wear, dental restorative materials, aging, chemicals, antibiotics. Coming to the extrinsic stains, it can be daily acquired stains. Stains may be plaque, food and beverages, tobacco, poor oral hygiene, and gingival hemorrhage, whereas chemicals like chlorhexidine and metallic stains. Gorlin classified the extrinsic stains again into non-metallic and metallic stains. Non-metallic stains include plaque, food and beverages, poor oral hygiene, and swimmer's calculus, whereas metallic stains include chlorhexidine stains and bimetallic salts. Like copper stains will be in green color, whereas potassium permanganate will be ranging from violet to black color. Silver nitrates include grayish discoloration, whereas stannous fluoride will have a brownish brown discoloration, and iron will be appearing as a brownish discoloration. These are different types of stains where different colors of your stains will be observed here. Nathos classified extrinsic stains based upon the chemistry of discoloration as N1 type dental stain, that is color of the chromosome similar to that of the dental stain, that is your tea, coffee, and your calculus, all those stains. They can be easily removed by polishing or you're using your toothpaste. Whereas N2 type of dental stain, it is direct dental stain, but colored material changes colors after binding to the tooth. Food that has been aged will be changed the color, so you need a professional intervention, that is oral prophylaxis and professional cleaning is required in that stage. N3 type of dental stain or indirect dental stain, it is a colorless material or chromogen material bind to the tooth structure and then convert into a chromogenic material and causes staining, mainly because of its oxidation capacity and chemical reactions. It is difficult to remove and it requires bleaching procedure. Coming to restoration related stains, it can be amalgam, where you can be aware of your amalgam hues and your amalgam, blues and amalgam tattoos. Composites on aging or on time tend to discolor mainly because of its micro leakage around the margins of your composite resins due to your polymerization shrinkage mainly, and pins and posts, those are most commonly tend to discolor. So coming to the main topic of discussion today, that is bleaching, it mainly involves lightening of the color of the tooth through the application of a chemical agent to oxidize the organic pigmentation that is present on the tooth. American Dental Association defined bleaching as a treatment modality mainly involving oxidative chemicals that will alter the light absorbing or light reflecting nature of a material structure, thereby increasing its perception of its whiteness. So mainly before going or taking up any bleaching case, you should have a thorough knowledge of your case history, diagnosis, and treatment planning. The first thing it involves was a case history and then your visual examination. You have to take your behavior changes into consideration, medical history, and recording the baseline data. That is nothing but the shade of that particular discolored tooth, and followed by your general oral examination, determining the soundness of your individual teeth, because the presence of crazed lines or cracked lines tend to penetrate your bleaching material into the pulp chamber. So in those cases, bleaching are contraindicated. Mainly the vitality tests. Vitality test whether you want to go for a vital bleaching or a non-vital bleaching. Before going any bleaching procedure, the complete oral prophylaxis of the patient need to be done. Coming to the mechanism of bleaching, there are three most common bleaching processes that is involving your peroxides, chlorine, and chloride. Mainly, it depends upon the volume of the bleaching agent rather than the percentage of the peroxide. So this is a redox reaction, that is oxidation reduction reaction that occurs during bleaching. Oxidizing agent is nothing but your bleaching material which has free radicals or your electrons which it gives up and becomes reduced, whereas the stain or your tooth is the reducing substance where it accepts the electron and become oxidized. In a simpler phenomenon, the high molecular weight complex organic molecules, that is your chromogens, that stain causing agents, will be adding with your bleaching agent and converting into low molecular weight organic molecules. So coming to the bleaching materials, many bleaching materials are available in the market. Mainly used are hydrogen peroxide, sodium perborate, and carbamide peroxide. Composition of commercial bleaching agents involves active ingredients and passive ingredients. Active ingredients mainly is your bleaching agent, which was you're going to use for your bleaching. And then these passive ingredients mainly to increase the shelf life and change the consistency of the bleaching material. So it involves thickening agents like carbapol. It is the most commonly used thickening agent and concentration ranges from 0.5% to 1.5%. Carrier, it is nothing but your propylene glycol or a glycerin. Carrier mainly maintains the moisture and help to dissolve other ingredients into that. Other one was your surfactant and pigment dispersant. It is a surface wetting agent to maintain the moisture of the tooth. And preservative. This will prevent bacterial growth and can accelerate the breakdown of your bleaching material. Mainly methyl or propylparaben and sodium benzoate was used. Your flavoring agent mainly improves the taste, and also urea, it is added to stabilize the H2O2 and elevates the pH of the solution. Coming to the hydrogen peroxide, trade name, it is a superoxole, and 30 to 35% concentration of hydrogen peroxide with 100% volume is used in bleaching, and it is a clear colorless liquid which later on will be changed into a gel-like consistency for a precise application with a pH of 9.5 to 10.8. It has a free radicals and peroxidized ions and indicated both in in-office and non-vital and non-vital bleaching. Commercially, it is available as 35% hydrogen peroxide, different trade names like Starbright, Opalescence Extra, where you'll have an Opalescence Extra boost in the market, which you'll have a 38% hydrogen peroxide gel. Coming to the other bleaching agent, that is your carbamide peroxide. It is a bifunctional derivative of your carbonic acid, mainly used in case of your home bleaching. Those are your low concentrations, that is 5, 10, 15, and 20% of carbamide peroxide. Whereas in in-office bleaching, you'll use 35% solution or a gel of carbamide peroxide. Next one is your sodium perborate, releases 9.9% of your available oxygen types of sodium perborate, monohydrate, trihydrate, or tetrahydrate. It is mixed with water, saline, or hydrogen peroxide, mainly indicated in intracorneal bleaching. Mekin's solution. Mekin's is the one who reported this technique where hydrogen peroxide, hydrochloric acid, and ethyl ether was used in a ratio of 5:5:1 for bleaching of your teeth of the patients with mainly the endemic fluorosis. Modified Mekin solution, it includes 20% of your sodium hydroxide as an extra. Coming to the bleaching material, you have to know in the bleaching mechanism where to stop the bleaching. That point is called as your saturation point. Prolonged usage of your bleaching agent causes the whitening action to slow down beyond a point. That point is called as your saturation point. Simply, the visible tooth color changes, that is the most discolored teeth, after application of your bleaching agent will lighten a little bit. After repeating the procedure of your bleaching, it again completely the stain will be gone and will become a normal teeth. If the bleaching is not stopped at this position, the deleterious effects of your bleaching will start here. That is, the further action of these acids on the enamel will break down the enamel matrix and complete loss of enamel matrix will be seen. So mainly the darkly pigmented structures will become lightly pigmented unsaturated structures and then converted into a non-pigmented structures. At this point, that is the saturation point where the bleaching should be terminated. So coming to the classifications of different bleaching procedures, depending upon the type of the tooth involved, the bleaching procedures can be classified as vital bleaching techniques and non-vital bleaching techniques. Coming in detail into the vital bleaching technique, based on the concentration of the acids used, it is either soft or weak bleaching or concentrated or power bleaching. Based on type of application, it can be at-home bleach or chair-side, that is in-office bleaching. Non-vital bleaching technique is also walking bleach, modified walking bleach, non-vital power bleaching, also known as thermo or photo bleaching, inside-outside bleaching, also known as in and out bleaching. So coming in detail into vital bleaching, it can be done as in-office or bleaching with Mekin solution, photo bleaching, power bleaching, or dentist prescribed home applied bleaching, that is called as matrix bleaching, and over the contour kits. Coming to indications and contraindications of in-office bleaching. Indications: intrinsically discolored teeth from aging or drug ingestion before and after restorative treatments to harmonize the shades of the restoration. Single tooth that have darkened from trauma but still vital. Very mild fluorosis stains. Contraindications of in-office bleaching: presence of excessive restorations, white spot lesions, severe tetracycline or fluorosis stains, hypoplastic teeth, young patients with large pulp chambers, crease lines, cracks, attrition, erosion, pregnant patients is a strict contraindications of your bleaching. Coming to the advantages and disadvantages, mainly advantage: patient preference, less time than overall time needed for your home bleaching. Immediate effects will be seen so that you can motivate the patient for your home bleaching. Disadvantages is more chair time, more expensive procedure, unpredictable, and deterioration of the color will be quicker. Frequent and longer appointment was needed, and dehydration of your teeth will be seen. Coming to the procedure, radiograph should be taken, complete diagnosis need to be done, and oral prophylaxis is indicated. Always evaluate the pre-shade, that is the discolored teeth shade with your shade guide. Confirm with the clinical photographs throughout the procedure and do a nice radiographic examination, prophylaxis, and then shade evaluation and good clinical photographs. Coming to the isolation, rubber dam isolation is mandatory and you have to protect the gingiva with the gingival barrier and nicely tight with your floss. And position your protective sunglasses over the patient and to the operator. And then optional procedure, you may etch the dent in before to increase the efficacy of your bleaching, but it's not mandatory. 30 to 35% hydrogen peroxide is mixed with the thickening agents and then applied onto the labial surface of the teeth with your applicator tape or a cotton fillet. And then your heat activating system, it is also not mandatory. If available, you can use the heating device of a power source of 50 degrees to 60 degrees, you can apply over that. Re-wet the enamel surface and reapply the same procedure. Do not exceed the exceeding time more than 30 minutes in a single visit. Remove the heat source and allow the teeth to cool for at least 5 minutes. Dry the teeth, gently polish it, and all the bleached surface should be treated with your neutral sodium fluoride gel for 3 to 5 minutes. Cold sensitivity is common, so advise fluoride rinse for 2 weeks and evaluate the patient for 2 weeks later. Coming to the activating sources of your bleaching, it can be conventional heat or light activation or chemical activation, a dual. Coming to the laser activated bleaching, the laser can be used for activation only. So you have to apply your bleaching agent, that is your hydrogen peroxide, and then followed by application of your organ laser and your carbon dioxide laser to enhance the activity. At home bleaching. It is also known as home applied bleaching, matrix bleaching, or night guard bleaching, or dentist prescribed home applied bleaching. It is easy to perform, less expensive. Carbamide peroxide was used along with your custom fit trays. So, indications of that was mild fluorosis, acquired superficial stains, tobacco stains, color changes related to trauma, minor generalized staining, age-related discolorations, and then mild tetracycline stains. Contraindications, like said earlier, severe enamel loss, inadequate restorations, discolorations of pulp chamber, large pulp chambers, severe fluorosis and pitting, pregnant patients, malaligned tooth, and patients who smoke is not indicated for this treatment. Advantages, simpler method, simple for dentist and patients also, less chairside time, less effective, cost effectiveness. Patient can bleach at their teeth at their own convenience at home. Disadvantages, patient compliance is mandatory, color changes depending upon amount at which the trace was continuously owned by the patient. In this, sometimes abuse may happen because of excessive usage of the trace. Operative procedure. Familiarize the patient with the technique, how to use the bleaching trace, and then to be followed, and what will be the expected outcome. Carry out prophylaxis, assess the tooth shape, photographs throughout the procedure, impression was taken, and then scalloping reservoirs was created on the cast, and then so that it will accommodate the bleaching material, and a custom fit tray was made. Patient instructions to be given for nighttime schedule and also the daytime schedule. Nighttime, brush and floss the teeth, 2 to 3 drops at the desired area on the bleaching tray. The bleaching agent need to be applied and then inserted into the mouth. All the excess to be removed, and then once overnight it to be worn, and then the tray should be removed, cleaned and stored properly. In that way, the treatment part was going on. Patient was indicated to not eat or drink while wearing those retainers. Daytime schedule, carbamide peroxide bleaching material should be replenished every 1 to 2 hours according to manufacturer instructions. Do not exceed the wearing time. Maximum wearing time was 12 hours. Non-vital bleaching. Intracoronal bleaching of endodontically treated teeth may be successful after the root canal therapy to deal with the non-vital discolorations. The method most commonly employed for bleaching the endodontically treated teeth or walking bleach or thermocatalytic techniques. Walking bleach. This was first coined by Nutting and Poe in 1961, referring to the bleaching action between the patient visits. Coming to the operative procedure, assess the periapical tissue and the quality of endodontic obturation, quality and shade of any restoration present, and then take a shade guide, match the teeth, clinical photographs to be taken, isolate the tooth with rubber dam, remove all the restorative material from the access cavity, expose the dentin, refine the access, place a barrier. For this, you have to remove 2 to 3 mm of your GP from the CEJ level and keep a barrier of 2 to 3 mm thick. That barrier is also not to be straight. It should be like a bobsled tunnel shape so that the effective seal of your dentinal tubules present at the CEJ will be covered, and materials used for your barrier placement was your polycarboxylate cement, zinc phosphate cement, glass ionomer cement or IRM. Mix the bleaching material, fill the access cavity with the bleaching material, remove the excess cement from your extensions of your pulp horns, and then pack it with temporary of 3 mm thick to ensure a good seal. Recall the patient after 1 week and again repeat the procedure. Walking bleach was a modified technique where you can use 30% hydrogen peroxide and sodium perborate alone, or you can use only sodium perborate alone for this better bleaching effect. Coming to inside-outside bleaching, this was the technique first described by Settembrini et al. In 1997. As the name itself implies, it is applied both on external and the internal surfaces of the teeth. So the access cavity should be completely open and devoid of access filling material. 10% carbamide peroxide gel is used for a 2-hour session for 5 times a day. A customized well-fitted bleaching tray for that particular teeth will be customized and then loaded with the bleaching agent and applied. Closed chamber bleaching or extracorneal bleaching. It is known as non-vital teeth bleaching using at home using 10% carbamide peroxide in a closed chamber technique. Mainly this was beneficial in cases where the existing restoration need not to be removed, and in totally fully calcified canals due to trauma where the negotiation of the canals was not possible for the maintenance purpose to deal with the discoloration, the bleaching was indicated. Coming to the post-op instructions, do not smoke for 48 hours minimum. Even it should be avoided because the reversal of your color will be there after smoking. Avoid foods and beverages that can stain. Mild sensitivity to hot or cold foods will be there for up to 48 hours. If any experiencing gum sensitivity, do not brush in those affected areas. Immediate whitening results can be quite dramatic, maybe due to dehydration of your teeth. It's normal for the color to come down after the rehydration to the natural white tone. Long-term results vary from patient to patient. This can depends upon the original shade of the tooth, including the habits of the patient. Touch-up treatment can be done 6 months or post 1 year also. Existing fillings or aesthetic restorations done on adjacent teeth will not whiten. Only the teeth will be whitened. So in order to match to the new smile, you have to replace those restorations. Coming to the adverse effects of your bleaching, the effects will be on your enamel mainly because it was applied mostly on the enamel. So mineral loss will be seen, surface morphological changes will be seen, alterations of your surface, micro hardness will be seen, effects on gingiva, tissue blanching, irritation to the gingiva, some amount of damage to the gingiva, effects of pulp will be seen, and oxidative reactions can causes the cell damage because of the release of your free radicals, because of the toxicity of your peroxides and high concentrations of the acids used. See, tooth sensitivity. This is the most common problem after post bleaching you'll come across. So in those cases, you can see that alterations in the cold and hot foods leads to hypersensitivity in those patients post bleaching. So mainly because the hydrogen peroxide penetrates through the hard tissues and reaches the pulp in those areas via your dentin pulp complex. In those scenarios, you have to give an active treatment like your fluoride toothpaste, desensitizing toothpaste, and passive patient, ensure the patient that this treatment was prolonged and you can stop the treatment if at home it was there. And alternatively, day by day, you can go for the treatment and reduce the treatment time or reduce the concentration of the bleaching agents used. Cervical resorption. This is also one of the most common complication. If the seal of your gingival barrier and your cervical CEJ barrier was not done properly, your resorption will be there because of seeping of your bleaching agents into the cervical areas. External invasive resorption has been reported in association with internal bleaching, both with and without application of your teeth. So hydrogen peroxide can diffuse towards your dentinal tubules and reaches your cementum, pedial, and also reaches your bone, acts as an counter irritant, and then osteoclastic activity will be increased, leading to resorption. Effects of bleaching on your composite and their bond strength. Automatically, there will be a reduced bond strength of your composite because the enamel was, the strongness of your enamel was reduced. So immediately after your bleaching, you should not bond your composite to your bleaching agent, to the tooth structure, because the bond strength of that bond will be decreased. So residual oxygen will be interfering with the resin infiltration of your dentin bonding agents into the dentinal tubules and prevent the resin tag formation. So always give a buffer period of 1 week to 10 days so that the enamel will regain its strength and then go for your composite restoration. If the time was not that much available, patient was in very much hurry, you can use some antioxidants in those areas and then immediately you can restore your composites. Rebound phenomenon. Regression of tooth whitening from the dental bleaching is a phenomenon occurs post bleaching. Once there will be little lapse of color after following 2 weeks, mainly because of your dehydration and hydration phenomenon of your tooth. Coming to the different clinical cases done in the department, first one is your vital bleaching, where the patient is having a fluorosis after giving a solid gingival barrier and then application of your hydrogen peroxide gel. This was the post-op result. This is pre-op and your post-operative result. Coming to the second case, this was a first session pre-op after 1 week of application of your in and out bleaching in this case. Gingival barrier was done, hydrogen peroxide bleaching was done, and the same pre-operative A4 the shade was for in case of 1-1, and then it was reduced to A2, and in case of 2-2 tooth, it was A3.5. Later on, it was reduced to A3 after post bleaching. This is the thing, you have to shade pre and post. You have to match the shades to educate the patient. And this is the second session, pre and post op. And the same procedure was repeated 3 times. And finally, this was the pre and post op pictures of final treatment. This was another interesting case where you'll have a non-vital teeth in 2-1 that is completely necrotized. So after taking your preoperative radiographs, you can see a big lesion suspected to be a periapical cyst. And this was the CBCT scans in relation to 2-1. This is the sagittal section where you can see the cyst. In this, the size of the periapical lesion, it was measured. It superior inferiorly 10.5 mm of the cortical bone loss was seen and measured distally 9.1 mm and buccolingually 8.4 mm. So in the first visit, we planned for root canal treatment, rubber dam isolation, access cavity preparation, working length, master cone, and obturation. These are the steps. In the first step, we did up to working length and it given nice intracoronal medicament seal. And then in the second visit, we recalled and give a master cone, nice BMP, chemomechanical preparation, and obturation. This is followed by another tooth. In the third visit, we planned a surgical endodontics treatment, that is surgical enucleation, periapical surgery. Followed 3 months after, we performed a non-vital walking bleach. So in this, the cervical 2 to 3 mm of GP was removed and the nice GIZ barrier was given, and then the bleaching agent was applied. For consecutively 4 times we did the bleaching session. This was a pre-operative, second session downwards, third one, and the fourth pic. If you observe pre and post-operative pictures, from that shade to this shade, there was a lightening of complete teeth. And later on, we advised crown for this patient. Coming to the conclusion, tooth whitening is a proven practice builder for both aesthetic dentist and also confidence builder for the patient. So bleaching, when combined with thorough diagnosis and treatment planning and meticulous procedure, not only beautification but also conservation of the teeth was seen. Bleaching standouts as inexpensive, non-vital, non-invasive, and lightens the teeth. The advanced predictable bleaching methods have created a new demand for cosmetic dental procedure. These are the references. Thank you. Thank you, Cynodent team, for giving me this opportunity to present in this esteemed conference. Thank you.